How does the USA health system work? Healthcare in the United States is organized in a complex well. In the reset of the world, healthcare facilities are owned mostly by government by private sector business. In the USA, a large share of hospital and salons are owned by private non-profit organization. Yet the United States is the country that has the will these expenditures are covered in large share by public payers as the federal institute or state and local governments. They can also covered by private insurance and individual payment. At the same time, unlike most developed nations, the USA health system does not provide health care to its increased population. As there is no single nationwide system of health insurance, the USA primarily relies on employers and voluntarily provide health insurance coverage of their employees and dependents. In addition, the government has programs that fund cover healthcare expenses for the foreign parts of the society as the elderly, disabled, and the poor. Those programs differ from and other and all have specific kind of people that are subject. Getting health insurance in the USA not everything sometimes something that once you have money everything easy, but fact thing or the bit are complex. One must be very careful and look out to pick the right insurance. Health insurance is the in the USA for non-citizens. The USA government does not provide health insurance for all its people, and health insurance is not ability for those living in USA. It's optional but highly recommended and necessary since health services are very costly, more than in any other countries everywhere across the globe. There are two types health insurance in the USA, private and public. Most people is combined to of what the USA public health insurance are Medicare, Medicaid and Children Health Insurance Program. Medicare is the nation's insurance program that back 1996. It's provide health insurance for USA nations older 65 years old, but also the younger people with end stage renal disease, some other disabilities. Data shows that in Medicare provided also most million individuals with healthcare in USA. Part 1, which covers hospital, skilled, necessary and hospice services. Cover services include some provides service will inpatients a hospital optional hospital charges. Yes, private health insurance. There are about 1,000 private health insurance provided in the USA, with each them offering different plans with different prices, which largely depend on the person's medical history. However, will there are includes plan covering on the persons. There are also group plans. Training families are practical.